you very much. Thank you. I'm very honored to have been asked, and I want to thank colleagues that I have met when I visited Islamabad 2 years ago with my colleague, my longtime colleague, Abdul Latif Sheikh. He introduced me to many of you pharmacists in Pakistan, and particularly Salwa San, and I'm very impressed with the work that she's doing at her hospital in Islamabad. Thank you also to Sundus Maria, who did all the arrangements with me, and thank you for all the emails and all the details. I also would like to say happy World Pharmacist Day to everybody. I know that many of you are wishing that greeting to each other, and I think it's very appropriate and wonderful that you're having your meeting actually on World Pharmacist Day. I also very much appreciated the words of Dr. Mansoor Qazi. What a wonderful colleague and support to have. So thank you for those kind words. I feel like I've met Mr. Assam Raf during my visit to Islamabad, and so it's nice to see you again. So I know I don't have a lot of time, so I will get started with my slides. So if you wouldn't mind bringing up the slides for me, I would appreciate it. I am going to talk about core strategies for establishing and improving hospital pharmacy setup, how the FIP development goals can help. And I have to start by saying that at FIP and in the hospital pharmacy section, we have two sets of goals. The FIP development goals are 21 goals that are general for all of pharmacy. So the next, thank you for that slide. And that's the main set of FIP development goals that I'm going to be talking about tonight. The 65 Basel statements are goals specific to hospital pharmacy. And we developed those together with many countries across the world specific to hospital pharmacy. And so what we are going to talk about tonight or today is how these goals can be used together to improve pharmacy services. I'm going to use steps and examples of using the two sets of goals. In the next slide, I'd like to show you what the FIP development goals look like. So in the next slide, please, we see the 21 development goals that FIP has put together. They begin numbering 1 through 7 on the first line, 8 through 14, and 15 through 21. They begin with academic preparation and competency and quality of training and education, and move on to leadership, working with others, equity and equality, pharmacy intelligence, policy development, and so on. And I'm going to pick a couple specific ones to work as examples this evening. Or today, I'm sorry. So the next slide, please. So this is a pictogram, if you will, of the Basel statements. And the way the Basel statements, again, specific to hospital pharmacy, were developed were along themes of the various steps in the medication use process. So from procurement to influencing of the prescribing and choice of medication for the patient, to preparation and delivery by the pharmacist, administration of the medication, often by nurses, monitoring of medicines by nursing, medicine, and pharmacy, and then human resource development and training. And there were some overarching statements that really talked about all of all of the themes. In the next slide, please. What we're going to look at is using the statements and the goals together. So may I have the next slide, please? So what I suggest that we do as pharmacists is to use the Basel statements first. A hospital pharmacy staff can do a self-assessment using the self-assessment survey tool that is asks questions about the various Basel statements. And I indicated that that self-assessment can be found on the FIP.org website, or this FIPHSA.com will take you actually directly to the self-assessment tool. You can use the self-assessment tool more than once, several months apart, if you will, to see what progress you've made. In the next slide, I'm suggesting that what we do is make the assumption that a hospital has done the assessment and they have prioritized medication safety from the Basel statements, which is development goal 19 in the FIP development goals, and antimicrobial stewardship, which is FIP development goal 17. So I'm going to show you how I think these will work well together to help you in your hospital pharmacies. The next slide, please. So starting first with the development goal, patient safety, I'm going to connect that goal to the Basel statements 38 and 45. So we're talking about patient safety, and statement 38 of the Basel statement says concentrated electrolyte products such as potassium chloride and sodium chloride and other high-risk medicines should be dispensed in ready-to-administer dilutions and stored in secure, separate areas with distinct labels. And then 45, statement 45, still in patient safety in the preparation theme of the Basel statement, says, doses of chemotherapy and other high-risk medicines should be independently checked against the original prescription by at least 2 healthcare professionals, one of whom should be a pharmacist. This should be done prior to administration. So what are the helps that we have from the FIP development goals that can help us accomplish the statements 38 and 45? So if I can have the next slide, please. I will show you the resources that are available that the FIP staff and volunteer expert pharmacists have developed. So for the FIP development goal on patient safety, a report on the pharmacist's role in medication safety has been written. It's an extensive report. It talks about the overall responsibility, really, of pharmacy to provide safe medications to patients. One of our primary responsibilities of all the things that we do. In the next slide, I'm going to show you some of the specifics that are in the report. So the report talks about, again, addresses that they're talking about the goal. And then they talk about, in the report, the mechanisms for assuring accurate and safe medication delivery. So it talks about encouraging all care professionals and key stakeholders, including patients and their caregivers, managers, policymakers, and educators, to consider designing and optimizing services collaboratively to improve patient safety. So just an example of some of the things that you should consider as you think about this FIP development goal in your hospital practice. And if I can go to the next slide with a further step in the report, I'll get to really some very specific points about medication safety best practices. So it comments on a global medication safety policies and identifies practices known to cause fatal and harmful medication errors despite repeated warnings. So specifically listed in the report are areas that you can work on, such as removing concentrated potassium chloride vials from nursing units, keeping them available and secure under pharmacy control, making sure that they are available to nurses when they're needed, but removing them from the nursing units because we've seen many, many errors and sadly some fatalities related to giving concentrated potassium chloride. It's cardiac poison, if you will, when it's given as a concentrated form. Second, use a weekly dosage regimen default for oral methotrexate and not in non-oncologic use. So methotrexate is another example of a drug that can be overdosed quite easily, and it's talking about a weekly dosage regimen default. So it's an automatic dose order to prevent too much of the dose. And then the third item, it's a very specific example about vincristine, and in fact, other vinca alkaloids, dispensing that in a mini bag of a compatible solution and not in a syringe. And partly this is to make sure that the vincristine is administered intravenously and not intrathecally or intramuscularly. It can be very, very harmful to the patient if it's administered by the wrong route. So you can see in the report some specific steps that are suggested that you can say, are we doing these things? Should we be doing these things? How do we get these things done so we can assure the safety of our patients? In the next slide, there are other resources all listed in that report. Again, still specifically addressing the goal, patient safety, FIP goal 19, but both the statements of Basel statements that I mentioned before. So it talks about safe medication practice centers, regulators, pharmacovigilance centers, and establishing safety around the world by operating error reporting programs. If hospitals keep track of their errors and report them, as opposed to hiding them, they will have much more information to work with in order to prevent them from happening again. So again, all little details about how you can move forward with these goals, working with the Basel statements and the FIP goals together. I have a couple more minutes to give you one more example. If I can have the next slide, please. Well, this is another toolkit and guidance document for pharmacists about medication safety. This is a medication use review tool. And again, it can talk to you about, can talk to staff about how they're using medicines and are they using them appropriately. It's a retrospective review, for example, of how medicines are being used in your hospital. And it tells you a lot of information about things that you might need to be paying attention to. Next slide, please. So the safety report can be found at the FIP website under publications. It's in the 2021 annual report just published of activities that were done in 2020. There's also a great webinar that was just given on September 17th, the title Medication Safety, Setting Goals for the Decade Ahead, again on the FIP website under events, and it's a recorded webinar. You do need to be a member of FIP to get the recordings. You don't need to be a member to hear the webinars when they're first given. Next slide. So 17 is antimicrobial stewardship. And antimicrobial stewardship is goal 17 of the FIP Development Goals. It actually is not one of the Basel Statement goals, and it's one of the areas that we are aware of that we need to update in the Basel Statements. But many people, because of WHO interest and interest around the world on trying to prevent antimicrobial resistance, has become a big goal for hospital pharmacies, community pharmacies, pharmacy in general, and together with our colleagues in medicine. We're very concerned about protecting the value of our antibiotics and so forth. So this goal is important, and if I can have the next slide, let me show you some resources. So in specific steps to establish antimicrobial stewardship, the resources include the FIP annual report for 2017. That's a multi-page report similar to the one I showed you on patient safety on specific steps on establishing antimicrobial stewardship. Again, it can be found at the FIP.org website under Publications Annual Report 2017. And then also a recording of a hospital pharmacy section webinar that was given on July 27th, 2017, titled Antimicrobial Use and Value of Stewardship Globally. It was by two speakers, two presenters who are both very familiar with global differences in initiating programs such as antimicrobial stewardship. And good advice is given about how to work with colleagues, particularly physicians, on antimicrobial stewardship and so forth. Again, the websites are at the FIP.org, and the webinar recording is under events.fip.org. So easy to get to and listen to. And I think you'll find them excellent. I listened to this one from 2017 just the other day. It's still very timely, and I think you'll find it very valuable. Next slide, please. So I thank you for attending this conference and for all of you working together to take better care of our patients. Having been in Pakistan and listening to you and your colleagues talk with each other and seeing the programs and services you provide, I'm very impressed with what you're doing and how we can all work together to take good care of our patients. So I thank you very much and wish you the best for today's meeting.